Did you know that your brain uses more oxygen than any other organ in your body? Hi, I'm Bernice Hunt, and I am a brain health specialist. I work with women just like you who are starting to notice a few memory challenges, and I help you to stay sharp so that as you age, you can still travel, have fun with your grandkids, and experience new adventures without missing a beat. As a wellness coach for over 12 years, I've talked a lot about a lot of things, but I never did spend a lot of time on oxygen until I became specialized in brain health. Did you know that the brain uses 20% of the oxygen that you're taking in? Because it has lots of work to do, and it can't do it without oxygen. In fact, your cells start dying in 5 minutes if they're not getting oxygen. So, oxygen is very important, but the flip side of that is the carbon dioxide, and we don't talk a lot about that, but carbon dioxide also has jobs to do. One of them is that it helps regulate your pH in your blood. And of course, most of us know about the fact that it ushers out those toxins out through your lungs when you exhale. So it has things it has to do. So really, we're talking about a balance between oxygen, which we need, and carbon dioxide, which we also need. We need to get those things balanced. Did you catch my last video? My last video was about breath work. That's controlling your breathing. And if you didn't catch it, it's a short little video. It's on my Facebook page, also on my YouTube channel, Keep Your Brain Sharp, and so you can catch it there. But today I wanted to continue talking about breath work and talk about the benefits of breathing slower and breathing less. So, did you know that there's something called over breathing? It's actually a thing, over breathing. Too much breathing going on. And if you do that all the time, you do that regularly, you do that a lot, it has a name tag to it. It's called the hyperventilation syndrome. That means you're constantly breathing too much. So that's really a thing, and it has causes, and it also has symptoms associated with it. Some of the causes of that, as you can imagine, is when you're stressed, when you're under anxiety or stress, you're going to start that hyperventilating thing, breathing in your shallow breathing and breathing more, which is not a good thing. Also, panic attacks. Some of you have panic attacks, and when you have those, you're going to start that again, and you're going to be breathing too much, taking in too much oxygen and not being able to release enough of your carbon dioxide, which is not a good thing. But there are also some medical causes of overbreathing as well. Be things associated with your lungs, like asthma, things associated with your heart, drugs, even certain medications can cause you the overbreathing. Infection, like sepsis or pneumonia, and also severe pain can cause you to do too much inhaling of your oxygen, okay? And that's not good for you. Now, some symptoms of that are some things you might not even think of, like dry mouth or numbness or tingling in your arms or something like that. Not having clear thinking, okay? You might be being dizzy or lightheaded, even having chest pain. So there's some symptoms that may mean that you're taking in too much oxygen too quickly. Now, just because you're not hyperventilating, or you don't have that overbreathing thing going on, does not mean, though, that you should not be breathing less, because there are some definite advantages and some definite benefits to your brain as well as the rest of your body. But we're specifically talking about to your brain if you learn how to breathe less. So that's what we're talking about. It's going to help your brain in a lot of ways. It's going to help you have a better mood. It's going to help you with your memory. It's going to help you with your sleep. It's going to help you with your concentration. It's going to help you managing stress just by breathing less, breathing slower, breathing less, okay? Plus, it's also going to help you with get more energy. It's going to help you think clear, and it's going to help lower your blood pressure. Now, why am I mentioning lowering blood pressure at the same time I'm mentioning your brain? Because did you know that vascular dementia is the second most common form of dementia? Alzheimer's is the first, but vascular dementia. By that, we're talking about damaged blood vessels, blockage to your blood vessels. And you know, we have 400 miles of blood vessels in our brain. That's the second most common form of dementia. The other side of that is that a lot of people get signs of dementia, symptoms that appear to be dementia, and it may be that you're not getting enough oxygen to your brain. So again, we're talking about proper breathing. We're talking about controlled breathing, because they say optimally you should be trying to work toward getting 5 to 6 breaths a minute. Most people get anywhere between 12 and 20. 20 is really getting on the extreme side there. That's too much oxygen coming in and not enough carbon dioxide being expelled from your body. You want to try to work on that controlled and slow breathing and getting the oxygen in. We're talking about belly breathing. We're talking about practicing your belly breathing, preferably with your mouth closed, because if you inhale through your nose, you're going to filter out some things you don't want to get into your system that might come into your system if you have that open mouth breathing. Okay. So if it's possible, the filter go through with your mouth closed and inhale through your nose. And you want to practice doing that. It's called controlled breathing, and it is very, very, very beneficial. Okay. So you want to take care of your blood pressure, because as I say, vascular dementia is number 2. So you want to take care of that, and it will help you to stay sharp. Breathing can do that. I know I was reading a book just the other day. Don't remember the doctor's name, but reading a book the other day, and he was talking about the synergy that we get from adding on beneficial strategies to our lifestyle. I know you may be doing a few or a lot of things, healthy things, but he was just talking about that when you find out something else that's beneficial and you add that to what you're already doing, it's like exponential. Instead of being 1 and 1 is 2, it jumps. 1 and 1 could be 3. It's going to help you more, and it's going to help the things that you are doing even become more effective. So if you're already doing healthy things, great. If you're not, that's great. You can start with this, but breathing slower, breathing less is so very important, and it takes practice. Be patient. Okay. But regular practice doing that will help you. So I have in my research library today, because there's lots of different kinds of breathing techniques. We have the 4-7-8, and we have the square breathing, and we have coherent breathing, and all other kind of breathing, which is wonderful. You can find something that you like, something that you're going to do, and do you regarding that. But there is one that is known to lower blood pressure, to be beneficial at lowering your blood pressure, and it's called the alternate nostril breathing. Alternate nostril breathing. And what you're going to do, you switch off between breathing in one nostril, inhaling and exhaling, and switching and do the other one, inhaling. I know you don't want to see that. That's not my best look. I know that. But anyway, I have written instructions in my resource library to show you exactly how to do it. And if you practice doing that, it is documented that it will help lower your blood pressure. It's called alternate nostril breathing. It's going to be in my research library. I think it probably is in there already. Go to my website, keepyourbrainsharp.com, and you can get access. If you don't already have access to my research library, you can gain access to that research library, and you can browse through there for look at whatever you want. But if you go to video number 166, this is Better Breathing, it will have that handout for you, alternate nostril breathing, because your brain's destiny is in your hands.